Cancer cases are increasing worldwide, and causes vary from tobacco use to excessive use of alcohol, air pollution, sunlight exposure, and certain infectious agents. But the fastest growing risk factor for cancer is obesity. And to help us understand that, we are joined by our medical expert, Dr. David Winter from Baylor Scott & White. Dr. Winter, tell us what is known about obesity as a risk factor for cancer? How are the two connected?
Yeah, we've known for some time in this country and many countries in Europe that when you get obese, you increase the risk of cancers. And the latest study comes from Sweden. Their scientists took 600,000 people between the ages of 17 and 60, followed them, and found that the ones that became obese had up to 5 times increased risk of cancer. Alternatively, the ones that stayed thin had less chance of cancer, Matt.
So Dr. Winter, just help us understand this here. What types of cancer are more common with those who might be obese?
Yeah, it's a variety of cancers. I've got my model here to help demonstrate. Cancers up in the brain, meningioma, pituitary tumors, cancer of the thyroid gland, cancers of the esophagus, in women, cancer of the breast, men and women, cancer of the colon, and then back to women, cancer of the ovary and the uterus. All those are increased when people gain weight.
And what's the correlation, if you don't mind, Dr. Winter, just us kind of asking this follow-up question here. What's the correlation with gaining weight and coming down with cancer?
We're not sure the exact cause, but they think there's 3 different factors involved: chronic inflammation, insulin resistance, and then the dysregulation of the sexual hormones. Those things, maybe in combination, can do that. We know that cancer cells occur in our bodies frequently, and our immune system is designed to detect them and then kill them. But when the immune system doesn't work well, it becomes overburdened. That's when the cancer cells can proliferate and grow. And obesity increases the burden on the immune system, Matt.
And Dr. Winter, is losing weight obviously the best solution for reducing this risk of cancer if you are obese?
Losing weight can make a difference. Bariatric surgery, for example, when those folks lose weight, their cancer risk goes down. The GLP-1 drugs, you take those drugs, less cancers. Now, you don't have to have surgery or just take pills. Losing weight on your own, that can also work with exercise, diet. Getting the weight down can help because obesity is a problem with your immune system, and being thin helps it out, decreases your chance of cancer.
Okay, Dr. Winter there with Baylor Scott & White giving us an inside look at obesity, cancer, the correlation between the two. Thank you so much for being with us, Dr. Winter.
Thank you. Good to be with you.